Your HIPAA compliance checklist? It's not protecting your patients, and even worse, it's giving you a false sense of security. If a hospital, clinic, or nursing home thinks it's secure because its policies check all the compliance boxes, but then it gets hit with a breach, then is compliance really enough? Most healthcare organizations today focus on the HIPAA privacy rule, which are controls around how PHI can be used or disclosed. But those privacy controls do not equate to cybersecurity protection. Protecting patients also means protecting patient data. And to achieve that, we must invest in both the HIPAA privacy rule and the security rule. The problem is, most healthcare organizations are negligent when it comes to the security rule. And I know this because when I ask them how involved their IT team is in the HIPAA security rule audit, they stare at me with these blank faces. The HIPAA security rule focuses exclusively on electronic PHI and is made up of 3 areas: administrative safeguards, which is basically your policies and processes; physical safeguards, which are your physical locations and their security processes; and technical safeguards, which are your tools in technical security. Now, this is where all the tactical work gets done to protect electronic PHI after risk is evaluated, understood, and appropriately owned. And for you CEOs and COOs, this isn't semantics. The gaps we find here, they have real financial, operational, and reputational impact. So I'm talking with a new CIO a few weeks ago, and I asked him if he'd completed his annual security risk assessment. And he responds confidently with, "Yep, we're compliant. Auditors signed off on it last month." Meanwhile, his IT team is constantly putting out fires from unpatched systems, inconsistent employee onboarding and offboarding, and device misconfigurations. So how can his organization be compliant when they're clearly so vulnerable? Let's be clear about the distinction between the HIPAA privacy rule and the HIPAA security rule. Now, the privacy rule governs patient rights and how PHI is used or disclosed, which applies to paper, orally, or electronically. The security rule protects electronic PHI or ePHI with safeguards like access controls, encryption, and risk assessments. If your organization only focuses on privacy documentation, you are ignoring the heart of the technical security that will help to prevent that inevitable breach. So, compliance does not equal security. Compliance means meeting a standard at a point in time through an audit, a checklist, or policy. Security is an ongoing process that evolves with threats. And to be secure, we have to understand our compliance gaps, the risks we're facing as a result of those gaps, and how those risks can negatively impact our organizations and our patients and families. Here's a takeaway. You can pass your compliance audit every single year and still have massive vulnerabilities that could get you breached next month. Most of the organizations I speak with have compliance people owning and managing their IT and security policies. They also have IT people that implement tools and manage the technical infrastructure that supports our interaction with sensitive data. The problem is, most of the time, these functions are disconnected, and what compliance says should happen versus what IT actually does are 2 different things. And this leads to gaps like systems that are not properly logged, or unchecked administrative access, or unclear accountability for things like incident response and disaster recovery. The most effective way to address these silos is just to get rid of them. But that can be a challenge when these teams work so independently, especially when one or more of them is outsourced. The secret to removing these silos and addressing these risks is technology risk governance. Tech risk governance exists to create and manage a repeatable and defensible framework that unifies IT, security, and compliance. Even better, it assigns executive ownership over technology risk and helps to mitigate budget creep. Compliance delivers audits and policies that not only meet requirements, but also that the IT department knows, understands, and actually implements. IT works more efficiently and implements the appropriate tools to reduce the risks that the organization has agreed to address. And most importantly, technology risk is owned at the executive level. Blanket yes and blanket no answers, they go away. And your executive team and board learn how to make critical technology business decisions that actually move the needle. The result is a dramatic improvement within the organization that decreases regulatory scrutiny, improves your care delivery, and reduces staff frustration. Now you see, while compliance is necessary, it's a baseline, not the finish line. If you want a clear way to see where your security and compliance program stands, download my compliance versus security comparison chart in the description. It's the same framework we use with healthcare IT teams to value their risks and mitigate the negative impact to their organizations. And if you need help with cybersecurity compliance or technology risk governance services for your healthcare organization, reach out using the link in the description. I'd love to support you. And also, of course, if you got value from this video, please help me out by liking it and subscribing to the channel. I release new healthcare security and compliance content weekly. See you next time.